Welcome back, and let's move ahead with the topic discussion for today's. So, ladies and gentlemen, we were focusing about many disease conditions throughout the series of programs where we consider IMED, and today also we will be emphasizing one of the most essential areas when it comes to a medical discussion. It is none other than sinusitis. So to the audience, we invited Dr. Chandra Jayasuriya, consultant ENT surgeon. Thank you very much, madam, for joining with us. Right, so we did a series of programs previously as well considering the discipline of ENT. So today, madam, we are going to discuss about sinusitis, which is sometimes more common and people tend to complain more. Madam, as an exposure, what sinusitis is?
Actually, we have sinuses in the skull. We have two sinuses here. They are called frontal sinuses. They are empty cavities in the bone. So we have two sinuses here. They are called maxillary sinus. Here the frontal, and between the two eyes. Between the two eyes, there's a set of sinuses. That is a long set of sinuses going toward the brain between the two eyes. So these sinuses give some light weight to the skull, because if the skull is full of bone, then we cannot even carry it.
Right.
And then it gives quality to our voice. Now there's resonation because there are empty cavities, so we have the quality to voice. And actually, to tell you the truth, 100% we don't know why the sinuses are there. But these are the two properties which given the light weight to the skull, and there is a voice quality. And there is a humidification of air through the nose, because when we breathe we need humidified air in the lungs, so and warm humidified air. So the nose has a function of humidifying air and warming the air. And then we get the sense of smell from the nose, and then it's a breathing passage. So, and then there's immune function also, because there are three ports where we get bacteria, viruses into our, and then even the substances, allergens, everything to our body, the alien substances. One is the respiratory tract, other one is the alimentary tract, the food passage, the other one is skin. Those are the three areas our body is exposed to environment. So what is the protective function? In the nose we get a thing called adenoid. In the children, adenoid gives some protection, so it produces antibodies after exposed to new substances. It produces antibodies and then get protection. In the same time, the throat you get tonsils. So what we swallow protected by tonsils, what we breathe protected by adenoids. So these adenoids also, it's an essential part of the nose, but sometimes when the adenoids are large, we get symptoms. We get runny nose, snoring and things like that. So anyway, these adenoids and tonsils are important in children, but when we become adults, these lymphoid organs, they are actually our guardians of our body. They regresses because we don't no longer we need those things. So sinusitis is caused by infection of these empty cavities in the nose, but I think a lot of times it's a misnomer. People think when they have headache they have sinusitis. So I want to clarify how we can suspect sinusitis instead of telling every headache I have sinus headache.
How can we differentiate, madam?
The commonest cause of headache is not sinusitis. That can be just tension headache, because when we are overworked, we complain, and then we get always the muscular headache, because there are muscles in the head and the neck. So when the muscles undergo spasm, we get tension type headache. And migraine is also another common headache. So those are more common than the sinusitis. But how do we suspect sinusitis is usually there is a preceding cold, common cold, viral cold, and then after that we can have double sickening, because with the cold we are sick and then we get better, then after about 6-7 days again we get severe headache, runny nose, yellow colored stuff coming from the nose. So if green or yellow secretions block nose, sometimes we clear our throat because the secretions come down and irritate our throat, and we can get reduced sense of smell, and then headache. Sometimes we get bad breath. Children, of course, they can get cough also. So sinusitis is suspected, and the fever. Very severe sinusitis, we can get fever also. So patient is very sick actually, not like in tension headache or migraine. So we have the signs and symptoms of infection, and then when we examine the patient, we can see yellow colored pus inside the nose, green yellow pus, and then we can see the redness, and then when we examine the mouth, sometimes we can see pus dripping from the back to the mouth. And then so we can do this with the cameras also, camera testing, and then tenderness. If you the doctor presses your forehead like this and this area, we get tenderness. The patient can jump with pain because there is underlying bone is also affected. So and then we can do full blood count and CRP also, because the white cell count will be high, CRP, the C-reactive protein will be high because it's bacteria. So that's how we can suspect sinusitis. The actually patient cannot diagnose sinusitis, the doctors should diagnose.
Right. So madam, there in certain conditions people try to say my head is paining. When we bow the head, it's like very heavy. The pain increases when we just turn the head down, and like when we shake like this, it like the brain like tend to move here and there. Certain types of things, it might be a certain severe case of sinusitis. Is that true?
Bending forwards can increase sinus pain, that's true. But as I mentioned, there should be yellow-green color discharge and nasal block with fever in sinusitis because it's an infection.
Right. So madam, when it comes to the ordinary types of headaches and stress conditions, you mentioned about certain muscle stiffness, and can you just explain that thing apart from this scenario?
Yeah, because it is the commonest type of headache. We have scalp muscles. I can show I can show a picture. So I will show the picture of muscles because these muscles can cause spasm. If I can get a closer view of
okay, we'll add them to the program.
So these muscles can undergo spasm, one above the ear, one like a cap completely covering the scalp.
Yes, that way madam.
And one is completely covering the scalp, and then here we can see another one, and then the neck muscles in the cheek also. So these muscles undergo spasm, and then we can't palpate the scalp muscles because they are over the bone, but we can always palpate these muscles. Then when we have the tension, these muscles are stiff actually. Then the patient jumps with pain when we press the muscles. So that is the commonest type of headache, with a good neck massage, hot fermentation, and then tolerating everything. These people are, people who get tension headache, they want everything in their way.
Right.
So they don't tolerate. Now in every work, whatever the job, there are many ways to do it, no? So these some people, they want everything to be done in their way. So they don't tolerate other methods. So sometimes they get angry. And so these some people are obsessively clean. So when everyone is not clean, no, and they don't keep things in order. So if you don't keep things in order, the other people get stressed, and the work stress also. Some people try to do things 100%, but it's not possible, no, to do 100%. So we try to do 100%, and they get stressed out. So the muscle spasm will disappear with a massage, but we have to change the way they think also. They tolerate things also. Then only the tension headache will go away.
Right, like it's like more than what medicines can do. They have to manage with some sort of other conditions that they deal
coping up. They have to cope up with the situation.
And even relieving tension and other certain things, yes, they matter. So you have to put them away when it comes to these types of conditions. So madam, just moving back to our original topic, that we exposed that thing because of certain headache types misdiagnosed with sinusitis, and people try to misunderstand. So like when people hear the word sinusitis, it becomes like a huge certain devastating disease. Is that so, madam?
No, it is not devastating. Even if we don't treat in a person with a good immune status, they will get better. But the illness time will be prolonged. So if we suspect bacterial sinusitis, that is, I told again, the double sickening. With the cold, you get better and then you become sick again. So then the patients, we can start antibiotic because we know the common bacteria. So the Streptococcus pneumoniae, don't have to mention the name, no.
Yes.
So the doctors can empirically start antibiotic. If there is an obvious pus, we can take a culture. So then when we start antibiotic for sinusitis, 5 days not enough, because the sinuses are within the bone. So we all know the blood supply to the bone is not very good. So we have to give the correct dose for about at least 2 weeks. Sometimes we give 3 weeks also. So until the patient is 100% okay, we have to, if we start antibiotic, we have to continue. Then sometimes we do after the antibiotic course, if we things are indicated, we can do a scan also, sinus scan, because infection is within the bone, and then we do the camera test also. We can examine with the camera, and then we know whether there are any polyps, because sinusitis infection, patients are predisposed to sinus infection when they have blocked to the sinus, any blockage. So what are the conditions which can block the sinuses? Polyps, growth. Sometimes all of a sudden a patient who never had a sinus infection can get sinusitis. Then we have to suspect, if it's an elderly person, whether there's a growth. And then polyps, of course, visible when we examine the nose with camera. Sometimes the bony defects, like you had a accident in the past and your nasal septum is, the middle partition is deviated, you don't get proper drainage of sinuses. So, and then the dental infections, I forgot to mention, because the upper jaw teeth are directly related to these sinuses, two sinuses in the cheeks. So some patients, after dental extraction, they can get sinusitis with bad breath. So we have to, in the history, we have to ask about that also, whether they have recent dental infection. So if there is a condition predisposed into sinusitis, we have to correct that also. So there is not enough to give antibiotics and treat the patient. Same time, find out whether there is any special reason to get sinusitis, and then we have to correct that. Then only patient can get total cure.
Right. So, madam, when it comes to use of antibiotics, you mentioned about sometimes 2 weeks and more than that, depending on the condition we have to proceed with. So some people tend to, when the symptoms get diminished, some people tend to stop the use of antibiotics, and sometimes when it gets worsened again, they try to continue the same dose or try to move to a new physician, saying that the early physician didn't give me the correct medicine. So discontinuing the use of antibiotics and moving to other antibiotics, how this affects this condition?
Because in our country, patients has the right or freedom to move to any doctor. So sometimes they find fault with the doctor and change. So then when we take antibiotic, we are harming ourselves as well as the society, because if the bugs become resistant to the antibiotic, it will not only affect me, it affects the whole world, because when the bugs become more and more resistant, we can't find good antibiotic for the whole world population. So if a doctor is giving antibiotics, if it is done according to the culture, if the correct bacteria is identified, we must take the correct dose, because this is a bony infection, we can get prolonged infection. And the other thing, the previous question you asked, whether sinusitis is a serious condition, I forgot to mention, it can become serious if the infection spread to the brain, because now these two sinuses, all the sinuses are close to the brain. So sometimes, and actually we don't see these conditions so much these days, because everyone is taking antibiotic, but pre-antibiotic era, before the antibiotics were discovered, patients used to die of sinusitis, because the infection can spread to the bone, brain. So all the patients don't get this, but if the patient is having severe headache, eye pain, and loss of consciousness, losing not only the full consciousness, but the level of consciousness may change. So those conditions, we have to do the imaging and get neurosurgical opinion as well.
That means there's a huge procedure that we have to undergo if the things are getting wrong and everything. So madam, once specifically a person getting certain severe headache, then he or she moves to a doctor, as you specifically mentioned that identifying sinusitis cannot be specifically done through the ordinary knowledge of people. He or she is diagnosed with sinusitis. So apart from those treatments, what are the other things that the patient have to proceed with?
Actually, they have to do the nasal irrigation because now I don't know whether you have heard, people who live by the sea, they don't get that much nasal infection because they bathe in the sea. Saline water, the salt water is a good antiseptic because the sinuses are filled with the saline water irrigated. So when we bathe in the sea, we know the saline water goes through your nose and comes out to your mouth, so you get good saline irrigation. So I heard mothers of down south, they tell, if the son says I have a cold, they say go and have a sea bath and come. So they knew that the patient will get better after a sea bath. So we still recommend saline irrigation. So that is obviously giving enough relief. So now this is a bottle. We can now, this is not yet available in the society, but it's going to be. We are still recommending syringes. So we can fill the bottle with saline. Actually, this is not just sodium chloride. We have to have sodium bicarbonate also, because that is alkaline solution. Alkaline solution kill the bugs, you know that. So this is very handy when the bottle is available. We can fill the bottle with the saline, and then you go to the sink, turn your neck like this, and then we insert the saline to the upper nostril. This is a squeeze bottle. It will nicely squeeze, and then the saline jet will go from this nostril, going back and coming out through the other nostril. And even babies, small babies, we can do this because the saline is not an irritant. They can, and then when you want to wash the other side, we can turn the neck like this. This is filled with saline, and then we squeeze the bottle. We don't have to turn the bottle even. We can, because this is, there's angle, no?
Angle, yes.
And then if we fill this with water, I would have shown, this will move. There will be a stream of water going. So then when we squeeze the bottle, we don't have to worry about this, because the bottle itself will do the job. Then it will go through this nostril and coming out through this nostril. So we bend the forehead toward the sink and do the saline irrigation. So saline irrigation also helps very much. So people who are prone to sinusitis can do this, because this is over the counter, we can buy, and any number of times you can do it, and throughout the life also you can do it.
So how can we buy this, madam?
No, still it is, it will come to the market, I think. This bottle we got as a sample. So this is a very good thing. Still we use syringes. But in all the other countries, these bottles are available. This is called sea water. Actually, there are sachets of salt. You can add to the bottle and then dissolve it, and then it's actually Ayurvedic medication. It's registered under Ayurvedic medication. Jalaneti, the yoga, Jalaneti, you have heard of it, no?
Yes, madam. There's a thing that to clean this, what you call this hygienical practice when it comes to nose and everything. So, madam, we recommend, apart from those salt sachets that is available, any, what you call, just homemade salt solution, is it prescribed?
Yeah, homemade also we can use 500 ml of water, 1 teaspoonful of table salt, and half a teaspoonful of sodium bicarbonate. They say equal amount, but when you take equal amount, patients used to say it's very smarting and you can't wash with that. But just ordinary normal saline is also, the table salt is also, but the tablespoon is variable. So we have to have 5 grams of salt into 500 ml of water. That's how we have to make it. And then if we don't have the bottle, we can take it to a palm, and then you can do that with the water in the palm. You can sniff with your nostrils, and then comes out through your mouth. But that's not very very handy, no? People won't do it. So if there's a syringe or bottle, that is more practical. So, and then you have to always teach the children to blow their nose. When children don't blow their nose, there's a collection of pus inside the nose, and then pus becomes a good culture medium for bacteria that keep on, the infection keep on going. So we have to teach the children how to blow their nose, how to irrigate their nose, and shower is okay, taking a bath, but we have to wet our dry our hair as soon as possible. And taking a bath in the middle of the night, I don't recommend it. Environmental temperature is also cold, no? So it is better to take the shower in the morning. Evening you should have a body wash, and then dental hygiene, as I mentioned, is important. antibiotic recommended dose we have to take. Decongestant drops I have to mention. We know people buy over the counter.
Yes.
These are very popular because when you put the decongestant drop, you feel very comfortable. But when we overuse decongestant nasal drop, patient get thing called rhinitis medicamentosa. So it like become an addiction. And then initially you feel very good with the decongestant. Day by day your nose is getting more and more swollen, and then you get worse symptoms. So should not use decongestant more than 5 days.
So without medical advice, madam, if there is a certain types of condition, for that type of days, is it okay to use?
For cold also over the counter, that's why it become over the counter medication. 5 days is okay, but not more than that. Saline irrigation is not like that. You can use lifetime.
Right. So madam, with this saline irrigation, can we just a certain ordinary person without having a certain sort of sinusitis has a good hygienic practice? Is it recommended?
It's a hygienic practice to clean your nose, as I mentioned, seawater bath. Like a seawater bath you can do, and then keep your nose clean, blow your nose, because some people don't blow their nose. They just do that and they keep take it in the mouth
inside.
And then that is not good, because when you snort like that, you are it is bad for your ears also. So it is always safe to blow.
Right. Okay, madam, some people, when it comes to certain headaches, certain sinusitis conditions, and just certain associated certain sort of disease conditions, people try to inhale water vapor or something like that, steaming with some medications. What is the
that is also recommended. Steam inhalation is good, but you should not overuse it, because sometimes there are nasty accidents can happen. Because you get large container of hot water. So what I recommend is take water a small bowl, small plastic cup with a wide mouth, and then with your towel you can get some steam inhalation, but not like and then the other one is for a baby, you can have a warm basin of water and then just close the bathroom door, then there will be water vapor fill the bathroom, because in small children you can't do the cover them with towels. So opening the hot water tap and keeping the bathroom door closed, you get some steam inhalation. So that is also recommended. No, we never advise not to do it, but not to overuse it also.
Certain ordinary applications people try to do some when there is a huge balms, and when there is a severe pain, people try to use some pain killing medications which are sometimes not recommended over the counter. Sometimes they might be having those things for a previous illness. So what is your comment, madam, on those?
Pain killers, paracetamol, okay. Ibuprofen also, if the patient is not allergic, ibuprofen is also available over the counter. Panadol, Panadine, ibuprofen can take, but correct dose, shortest number of doses they can take. And then the local application I recommend, because when we apply a balm, there is local irritation, and then there is a thing called gate control theory, I think you can remember. When we concentrate on the pain in the nose due to this burning sensation, we forget our headache. So it is not directly acting on sinusitis, but it gives relief. Definitely patients can do it, because with severe headache, when you apply some balm over your forehead and your over your nostrils, you feel and then over your neck. Definitely you will feel better. So that's not prohibited, that's okay.
Right. In certain conditions, madam, some people tend to have certain head massage, saying that a good blood flow will cure certain sort of head related issues, basically for sinusitis and other conditions. What about that?
I also strongly recommend head massage, because as I mentioned earlier, the pictures, when we massage these muscles, here there is a muscle, and then here over this area we can massage with our heel of the palm, and then the neck, here these two muscles we can massage like this, and the back this like this. But you can't do the massage on your own, because when we do the massage, we have to relax and stay calm, and then another person should massage. So actually I have an instructional video also in the internet. I have put it in my YouTube channel, so people can learn how to do the massage properly. We can have a hot fermentation, and there should be medicated oil or some balm, because otherwise fingers won't nicely fingers are not lubricated. So you need a lubricating balm, and then the balms also have a nice smell also, and then there's a burning sensation, as you asked earlier, that also gives relief. But the massage is definitely helping, not only sinusitis, the tension headache, migraine. Every headache is helped by a massage. So every day, if you can ask some of the loved ones to massage, there's two things actually. The relationships also become better, no? So because you have to get a massage from the other person, you have to be nice to that person. And then when the other person massages, you always have a soft corner for that person. So I think many ways massage will help the society. And then people who don't have anyone to care, they get the massage from the barber or the salon girl. The salons, so the salon people, actually beautician, they know how to give a massage. So then some people say, I stay alone at home, how can I get the massage? Because I always say, no, doing a massage alone is not very helpful. Then I recommend to go to the barber. Or physiotherapists also give massage. Physiotherapists.
So, madam, when it comes to the sinusitis condition, people take medicine and certain practices, so these massage mechanisms and certain things that we discussed, they might be proceeding with. Is it disturbing and life-threatening sometimes, as you mentioned, and even people might think that is it not getting cured? What is about that?
Yeah, that is a good question. Actually, when the sinusitis is not getting better, we can do surgery, because the sinuses we have to clear. So this picture, I can show this picture. These sinuses are nicely draining with there are hair containing cells. All these sinuses will nicely go to the nose. Drainage goes to the nose and it goes to the mouth. Without our consciousness, we swallow this phlegm. And when you can see the other side, sinuses, the phlegm, the cilia, the hair cells are not working, and there's a collection of pus. Can you see?
Yes.
There's a collection of pus on the other side. So if there's a collection of pus, what should we do? We have to take that pus out. So these operations, they are not major operations. We have to. The patient is not getting better, patient has to face operation. So then we have to take the pus out, and then we can, when the pus is out, we can give the proper antibiotic according to the bug, because we can send it to the lab. And then if there are polyps, I told you, to resolve these problems, patient has to undergo surgery. Before surgery, we always do a CT scan. Contrast, we don't need to give contrast, but just a ordinary CT scan will help to know what is wrong with the nose. Because nose, actually I tell, nose is like, we get two nostrils here, but there is enough space to even park a car. Because here, everywhere, the surface area of the sinuses is huge. So now we have no way of knowing all the sinuses, even by passing a camera, because sinuses are hidden spaces. So the best way to investigate sinusitis is to do a CT scan. So if the patient is not getting better, and the brain also we can see at the same time. I told there are life-threatening complications which spread to the brain and the eye. So some patients go to the eye hospital with complications. So we can show a picture of eye complication also. Yeah, actually we can show it in the screen also with as a separate picture.
Yes, sure.
This patient has a eye complication. You can see the eyes. Can you see? Eyes red and close, because this patient has sinus infection and it has gone to the eye. Sometimes it can end up with blindness.
Can this condition be reversed, ma'am?
Yeah, because if they come early, we can even save the eye, but sometimes we can't save the eye because patient has already got.
Yes, there are some more pictures.
Yeah, shall we show the pictures now, or you can insert?
Yes, we'll insert them, and we'll now also with the discussion we can just move ahead, ma'am.
I can show the condition which can block the sinuses. This one is actually, you can see the septum is deviated. It is not in the midline. Picture 46 here.
Yes.
The septum is deviated.
The small part that has
Yeah,
come out.
yeah. So it can block the sinus. So this one you can see polyps inside the nose. Can you see the shining
Yes.
things? Those are the polyps inside the nose, and these are the turbinates. These are the swellings in the nose. We all of us have this swelling.
Yes.
Yeah, we can see these swellings are inside the nose. All of us have it, but when they are big, that can block the sinuses. These turbinates. And then I was talking about the adenoid. I will show the adenoid also, because the adenoid can cause. This is the adenoid. This adenoid with the arrow, can you see? So it is behind the nose. This is the back side of the nose. And then this adenoid can cause the sinusitis in small children. Because the adenoid is very big, secretions can't go to the mouth. So everything is collected inside the nose. So children have a noisy breathing. They may snore also.
Yes.
And then this is the picture of a child where they have symptoms. You can see the child is mouth breathing and there's tearing from the eye, and the nose is small and the face is also not well developed. Child looks miserable. So when the adenoids are infected, this is the picture. So if your child is mouth breathing and snoring and miserable, you must suspect adenoid infection.
All right. Like, madam, moving ahead with this formal thing, what sort of connection do we have with allergies to sinusitis?
Yeah, actually we forgot to mention was in swelling of the nasal lining. So what is allergy? When we get an alien substance, we are exposed. First time we don't get a reaction. Second time, body recognize this as a enemy. And then there's a reaction. Then what do we have? We the patients who have allergy, they know they have a runny nose and they have sneezing, itching, and then eyes also can itch. Sometimes asthmatic attacks you can get. So allergic conditions can affect the whole respiratory tract. So when there is lower down affection, you get asthma, but in the nose you get rhinitis, rhinorrhea. Sometimes you cannot go to school, you cannot go to work because there's headache, nasal block, secretions, the watery secretions come, you get headache. So when the allergy, how do you diagnose allergy? The patient themselves, they know they are allergic to certain substances. Some people are allergic to cobweb, dust, and then animal dander, certain pollen. Luckily we don't have seasonal rhinitis in our country. We don't have spring, summer, but in other countries they are exposed to these allergens in the season, spring and summer. So, and the cockroach is a known allergen. House dust mite, you may have heard.
Yes.
This dust mite is an invisible bug. It's a mite. So when we are exposed to these dead mites and their species, we get severe allergic reaction, runny nose. How do we get this? Because our skin sheds dead cells. So this mite, they are fed on these dead cells, and then this invisible, we don't know. We don't have we have house dust mite allergy. So how do we know this? When they go to the bedroom, when the bedroom is full of things like books, toys, curtains, doormats. When we have so many things in your bedroom, you get enough space for these mites to harbor. Now, like if they have soft toys, you get thousands of dust mite. And you know that nowadays we don't discard our mattresses. We keep them for years and years, 25 years, 30 years. So this mattress is like a cemetery.
Yes.
Yeah. So
they even give a warranty for 10 to 15 years.
So they give warranty. And when we were small, we used to discard mattresses, and our mothers used to sun dry all the linen and the pillows. So it is a very good thing to sun dry. Because all these might get killed with sunlight. So actually it's a good question you ask. If we suspect dust mite allergy, we have to get rid of all the soft toys. Should not sweep the floor, because then the dust mite, dead mites and their feces will be all over the room. So we have to mop the floor with Lysol, and then bed linen has to be boiled and washed and sun dried. Mattress at least we have to vacuum clean if you can't get rid of. Pillows we have to wash. So it's very difficult to get rid of house dust mite. But all these things, and I prefer if you have only the bed in the room and nothing other than the bed.
Right.
And then even the curtains are not good. You can have blinds but not curtains. So then when we do all these, plus nasal irrigation. If you have allergen in the nose, nasal irrigation will also help. So nasal irrigation for your nose and dust mite eradication measures for the room. Then patient will get better. But allergy, unfortunately, these allergic conditions are genetic.
Right.
So sometimes you may get problems until you die. But when you are older, allergic reactions are less. But young children and young adults, they are affected. So we have to find out the allergen. There are tests to find out allergen. There are skin prick tests, blood tests also. But they are expensive. But good history will help us to diagnose the allergy.
Yes.
Sometimes in doubtful conditions, we do the skin test and the
some
blood
IG reports or something like that.
Yeah, we can do skin test, and so allergens are also a very common predisposing factor for sinusitis.
Right. So, madam, just emphasizing that thing, sometimes some people tend to say that chicken is allergy for me in a certain case when it is prepared in a different manner. So, sometimes that is not. Sometimes the underlying cause is a totally different thing. Might be the house dust mite that is come to as an allergy. So, when it comes to the sinusitis, is it a good advisable condition to be aware about exactly what makes allergy for you and to prevent from that?
Yeah, that is true, because you can get even worse condition like asthma. Sometimes you can get severe allergic reactions also. Some people are allergic to nuts and that can kill them also. So patient is the one who has to tell the doctor, I am allergic to this. But meat allergy also can happen. We can get a good history and find out the allergen, and then try to best treatment for allergic rhinitis is avoidance of allergen and washing out the allergens by doing a nasal irrigation. And then symptomatic treatment is we can give antihistamine drugs, and then the steroid nasal sprays and drops. We forgot to mention about the nasal drops and sprays. So in the long run, allergic rhinitis is treated by avoidance and the steroid treatment. Steroid we can give oral as tablets, but giving tablets can have side effects. But local medication, like we would treat your asthma with inhalers, like that we can treat our nose with nasal inhalant steroids. So that will give immense relief. But we have to have them for a longer period. Antihistamines are symptomatic relief. So you don't have to give the patient on antihistamine for a long period. But whenever there are symptoms, we can take antihistamine, but steroid nasal sprays we have to take long term.
Right. So, madam, apart from as a pain relieving medication, people tend to use paracetamol and certain conditions ibuprofen or something like that. And apart from that, madam, it's common that people use antihistamines. So, when it comes to this type of a condition, prolonged use of antihistamines, sometimes daily, sometimes they are not resistible. Like that means in the initial stage they might be okay with a small pill, but later on it won't do. Like, what is this happening? Or antihistamines using for an extended period of time, years and years?
Antihistamines, actually they are metabolized in the liver. When we take an antihistamine, after about a month or so, we may not get the requested symptom relief, because our liver is getting used to it and they are destroyed in the liver, so you don't get proper relief. So antihistamine, when one antihistamine is being used for years and years, actually it's useless. That's why I am telling you can take antihistamine, but you have to stop in between, and then we can give a different one sometime. And antihistamines are not as harmful as decongestants, but antihistamine, actually they tell you the truth, it doesn't give enough relief, because after some time body get used to it and you don't get any response. So that's why you should not use it every day. Sometimes
it's the mental condition that makes us the relief, but not the antihistamine. There are certain placebo effects and certain certain other things which comes to medications, might not the medication giving the best effect. So when it comes to a medication, you must seek medical advice and you must seek the professionals guidance to use those medications, because as you already that doctor mentioned, this tablet is metabolized in the liver. You might not knowing the fact that where it is being metabolized, or you might not be aware about what metabolization is. So in that context, other than making it a harmful aspect to the body, ingesting certain pills, spending your money, and even spending on other investigations later on to check the liver and everything, just take some medical advice. So madam, again for sinusitis, when it is under medical attention, repeating the same prescription or without meeting a doctor 2, 3, 6 plus years, is it good to maintain, or continuously we have to meet the doctor?
Sinusitis, as I mentioned, we all are vulnerable for sinusitis, because common cold is universal thing, and after common cold, I think most of us have at least once we have met sinusitis, we have got sinusitis. So treating it properly will give you relief. You don't have to continue anything. So you have to meet the doctor, take the antibiotic, the correct dose, correct time, and then you look after your nose with irrigation and things, you will be okay. Then you don't have to get it over and over again, unless you have allergy or polyps or some condition which make it chronic. Acute sinusitis is a treatable condition. Anyone is vulnerable, and you are not going to get it over and over again. But chronic sinusitis means after about 3 months also you are not okay. Then you must see a ENT surgeon. Then the ENT surgeon will taking sinusitis, acute sinusitis treatment from your GP is okay, the ordinary doctor. But if it is, you are not getting better for 3 months, then GP won't do. You have to meet a ENT surgeon. Then we will do the, as I mentioned, we will do the CT scan, and then we will try to find out why this person is not getting better, and then we will treat the underlying cause. Then the patient will get better. So that's why I told the patient might need surgery. We have to correct the deviated nasal septum. Polyps are there, we have to remove them. If the growth is there, we have to take a biopsy. All these has to be done, only can be done by ENT surgeon.
Right. So there are certain conditions that how to proceed. So general physician will limit to a certain extent, and ENT surgeon will proceed with the rest. That is how sinusitis appear, and you have to manage. So that's what we today discussed on your episode. I made sinusitis, certain conditions, symptoms, treatments, and how you can proceed with. So thank you very much, Madam Dr. Chandra Jayasuriya, consultant ENT surgeon, for doing the honors with us, explaining what sinusitis is, the consequences, treatments, and how you can maintain the disease condition without making it a burden to your other health issues. So ladies and gentlemen, we are about to wind up this program. We'll be having a nutritional tip, a small video clip. After that, the program will be ending. Stay tuned with the rest of the programs. Continue with IMED will be giving you most of the important disease conditions and advices to lead a successful life. Thank you very much. Have a pleasant day.
About it, allergies